We're going to start in three, two, one, go.
Hello, this is Dr. Adjo calling from the practice. Am I speaking to George Mitchell?
Oh, hi, Doctor. Yes, it's George speaking.
Hi, George. I had a look on your record, and I can see that you had some blood tests, and you are here to discuss the result. Is that correct?
Yeah, please, Doctor. Yeah, I mean, actually, I got a text message from reception today saying that you needed to speak to me about something wrong with my blood test result, but she declined to say anything with it. So, yeah, that's why I'm here today.
Okay, right. Did you have any chance to look through the results through online app or by any chance?
No, unfortunately, I'm not a tech person, Doctor, so no, I haven't.
No problem. That's why we are here today. Before we go forward, can I check why you had those tests in the first place, George?
Yeah, I mean, it was actually a routine blood test. Actually, I've been feeling very tired. I've been feeling very drained, Doctor. I'm not even half the person I used to be in the past. So I had a chat with one of your colleagues, practice nurse, and she said, let's do some blood tests. And here I am.
Okay, right. I mean, you did the right thing by seeking medical advice regarding the tiredness. Can you just remind me for how long you've been feeling this way?
Oh, it's been a while, Doctor. I was going to say maybe over the past few months' time.
Okay, right. And anything apart from the tiredness and feeling drained? Any other symptoms?
Well, like what, Doctor?
For example, have you noticed any bone pain?
Oh, yeah. I mean, I've been noticing that I've been getting some bony aches every now and again, Doctor.
Mm-hmm, right. And where is the pain? Where is the bony pain?
Oh, it's all over my body.
Okay, right, okay. And how are you coping with the pain and the tiredness?
Well, it's quite difficult with what's been going on, Doctor. So yeah, I'm trying anyways.
Yeah, you mentioned with what's been going on. Is there anything specific going on at the moment, George?
No, just because I'm the main carer for my wife, and she's got dementia, and the only one who's actually looking after her at the minute. Don't get me wrong. I mean, my daughter actually is so lovely, but she lives in a different city, anyways, and it's very difficult to the nature of her job to come and have a check on her.
Yeah, and you find it difficult to cope with the responsibility of caring to your wife.
I do, yeah, I do. To be honest with you, Doctor, yes, yeah.
Yeah. It sounds like it's a difficult situation and challenging, George. Yeah. And how is your wife doing?
I mean, she's fine. I mean, nothing has changed anyways. She's really dementia. Yeah.
Okay. All right. Okay. Apart from those symptoms, have you noticed any change in your weight recently?
No, my weight is fine, Doctor.
Yeah. Any night sweat?
No.
Okay, right. And then having those symptoms for a while now, it's been affecting your daily routines. Has this affected your mood by any chance?
No, my mood is fine, Doctor.
Okay. And then, giving those symptoms, anything comes in your mind, what could be the reason for those symptoms?
Well, I mean, I had a chat with my daughter, Doctor, and I mean, she's a pharmacist, and she kept saying that it could be the statins that I have increased recently. So yeah, I mean, that's the only thing I can think of, really.
Yeah. Okay, right. And then, I hear you when you said that you do have this responsibility as a carer for your wife, and with those symptoms, has this made you worried by any chance toward anything in specific?
No, just I mean, it's my wife, as I mentioned, and also I get my my friends, sometimes they come and sit with us to try to help my wife as well, and it's very difficult to cope with everything while here and doing stuff. So yeah, I feel if I am better, then everything else is going to be fine.
It's going to be fine. Okay, right. And in terms of your other day-to-day routine, like cooking, shopping, that kind of thing, are you managing that?
Yeah, I am to some extent, yeah.
All right, okay. And a few questions regarding your lifestyle. Sometimes it can be related to the results. Have you ever been a smoker?
No, never.
Yeah. Do you drink alcohol regularly?
Just very occasionally, Doctor.
Okay. Any family history of any bone problem or bone tumor or cancer?
No, I mean, my mom had osteoporosis, I guess, and my dad had arthritis, but that's the only thing I can think of. Yeah.
Okay, all right, okay. So thank you for answering those questions, George. And let's have a discussion about those results. So we basically check for a few things. We checked for your can't remember. Sorry, I can't remember the bloods. But when I had a look on your record, they all came back normal, including certain enzyme where we send if we do have any concerns regarding statin. When people complain about like bone ache or tiredness or drained.
Okay.
So I can assure you that this enzyme came back normal. So it sounds like this is unlikely to be due to increased statin dose, George.
Okay. So what else could it be, doctor?
Right. So one of the tests that we tested was for your liver enzyme, and one of the liver enzyme is out of range, which is on a higher side, like higher than normal.
Oh, does that mean that there's something wrong with my liver, doctor?
Well, that's a sensible thought about the liver. So when we have this with this enzyme, raised along with having like a bone ache, tiredness, it's a picture of a condition we call it Paget disease related to the bone. Have you ever heard about this?
No, not really, doctor. What is that?
So Paget disease is when the bone turnover mechanism in our body with an increased age that can become more than quicker than usual or faster than usual, and that can make the bone weaker and larger in size, the bone cells. Are you following me?
Yeah, I guess so. Yeah.
So it's a type of a bone disease. It's a long-term condition of the bone. It's non-curable, but the good news, there is lots of things that we can do together to try to support you moving forward.
Yeah, I'd love to hear about that, doctor. Yeah.
Right. So there is a few things we can do, few things you can do yourself, and then we will do like a regular follow-up every few months to check on your symptoms. Anytime if you notice that the pain got worse or you start having the tiredness affecting your day-to-day more, then please come back to us sooner. Okay,
I'll do that. Yeah.
Okay. So in terms of things you can do, there is a few options of having a painkiller. I was wondering if you tried any painkiller in the last few months?
Well, I mean, I tried some paracetamol, doctor. I tried some ibuprofen, but nothing seemed to be helping out,
Okay, right. So you tried some of them. I think it would be sensible if I refer you to the bone doctor, the specialist, and then they can have like assessment and discuss other options of treatment for this condition. What do you think about that?
Yeah, I mean, if you think that's going to help, doctor, I'm more than happy to follow you.
All right. Okay. I mean, while waiting, because you keep having those symptoms, and you are doing really good job by taking care of your wife, and you're trying your best. But have you thought about any other options that we can offer to your wife? I hear you when you said your friend is coming on and off, but have you thought about any other support that can be provided to your wife meanwhile?
No, not really, doctor. I mean, what else could be offered to her, doctor?
So we can check if she can have like a carer package by involving the social service, and those are the team that they can come a few times a day and do like help you caring about your wife, and that time you will have some rest as not to strain yourself more. What do you think about that?
Well, I mean, yeah, thank you for the offer, doctor. But I mean, my wife is quite, severely dementia, and she might struggle with, new people coming in and out. She barely knows my friends anyways, but I'm just imagining if somebody she doesn't know comes over every now and again, and that can be quite challenging. But thanks for the offer. I might consider it in the future.
Yeah, I mean, yeah. With the dementia people, with the progressive dementia, they might find it really challenging to try to know or speak to the new faces. However, those teams, they can, like, they are trained people. They can take, conversation very sensitive, and they can reach her, like, in a way that she might accept or tolerate.
Hmm. Okay, yeah, yeah. As I said, I'm going to think about it. I'm going to let you know.
All right. Okay. Okay. I mean, I just wanted to let you know that one of the other blood results, we checked for your vitamin D, and it came back on the lower side. We called vitamin D insufficiency. And I meant to ask about your diet as well.
Yeah.
So having vitamin D insufficiency can be one of the causes of feeling tired and drained as well, George.
Oh, okay. Yeah. So does it mean that I have low vitamin D, doctor, then?
Yeah.
Okay. So what should I do, doctor, for that?
That's a good question. When we have this, I mean, in the UK, it's common to have a vitamin D insufficiency, and we do advise people to try to take a vitamin D and calcium supplement from over the counter, and that's with the daily dose of 400 to 800 international units. Do you think you can do that?
Yeah, I mean, I can try that. Yeah, that's fine. Yeah.
Okay. Another blood results showed that your cholesterol, the cholesterol is still higher than normal, although we increase the dose of statin. So I think it would be worth to get you seen with our practice nurse, and then she can do the calculation, and then have a chat about those results in a separate appointment. What do you think about that?
Well, I believe that was the reason why it was increased actually to 40 milligrams stock. All right, thank you so much. Right, welcome back. Welcome back. Thank you so much, Dr. Dina. How did you feel?
Well, I do struggle with the case of test result when there is few results to discuss, and I do understand that we don't need to discuss all of them in one consultation or in one case. Appointment, but I just struggled to try to split them down and not to be confusing to the patient in this case. So yeah.
Perfect. How about your overall performance? How did you feel about that?
I think the patient was okay, like not a difficult patient, and I managed to pick the cue of him being a carer for a wife, and that is affecting the symptoms. I think, yeah, I think it was okay, but I could do better maybe.
Okay, no, that's absolutely fine. So first of all, thank you so much, Dr. Dina. It was a very, very nice case. Actually, it is a difficult case to some extent, but you did really well in this case. So thank you so much, and thank you for volunteering as well. So let's talk about like general feedback first, and then dive deeper into the more specific feedback of this case. So as a structure, it's very, very important to have like a very rigid structure. Rigid, by that, I don't mean that you shouldn't be flexible. So by rigid is actually to have a structure in your mind, know what to ask. Don't waste any time thinking about, oh, what's the next question is going to be? Oh, what's the next part in my structure is going to be? So in your performance today was very good. The structure was also good. And as you mentioned, it could be slightly better, but that's absolutely fine. That's all what we're here for. That's all what we're here to learn, actually. So whenever we actually start the consultation, we've discussed that before. So it's very important to get any information in the notes and actually try to verbalize them. So I can see that you're here today to discuss your most recent blood test result. Am I correct by saying that? Or are we discussing anything different? So this is very, very important. And actually, the more you get a powerful start, the more likely the examiner is going to be very, very, very happy with you, very happy to listen to you during the consultation. So imagine examiners are actually pleasant. They are very cool. They are actually listening to like many consultations every day, and then towards the end of the day, you might get a little bit tired. But when you start a consultation, it should be very powerful. The way how it's going to be very powerful, whenever you have any information and also please start by saying, oh, I can see that you're here today to discuss this. I can see that you're here today to discuss that. Are we correct by saying that, or are we discussing anything else? If we don't have any information and notes, so we can say, good morning, my name is Dr. Aju, and am I speaking to Mr. John, for example? And then what would you like to discuss today? What would you like to talk about today in a more of a friendly manner than how can I help you today? I don't like how can I help you today? How can I help you today? Imagine you are someone who actually works in a call center and every day, oh, how can I help you today? How can I help you today? No. A more powerful start is what would you like to discuss today if you don't have much information in notes. However, as we've discussed, if you have any information in notes, it's very good to start with that. Then it comes most important thing now, which is an opening statement. After how can I help you today, then it comes a very important thing. Would you please tell me more about what's been going on? Tell me more. It's going to give you very important information that you might even haven't thought about asking about them. So could you please tell me more about why you had this blood test in the first place? So this is a very important thing. Gives you extra marks. A very important thing. Don't. And by that I mean, please don't. Don't start your consultation by going for closed questions. Don't do that. Please, the more the closed questions you ask, the less the information you're going to get. So very important, ask an open statement, open question first, then go for the closed ones. If you have been attending my sessions over the past few months, few years, you might know that I always divide the consultation into chunks, and these chunks I call bubbles of consultation, and these are very important. This is your structure in the SCA exam. Structure is very important, as we have discussed. Your structure should be rigid but flexible at the same time. Rigid meaning that you actually shouldn't think about it. It should come naturally out of you. Now, very important, ICE is a very crucial part of your consultation. So ICE is a very crucial part. Try to do that as early as possible. Try to do it as early as possible, okay? So do not leave it till late. ICE, very important. Ask it in a non-generic way. Have you got any thoughts about what's been going on? Are you worried about anything at all? What are your thoughts about how we can help you today? Have you got any thoughts yourself about how we can come up with today, for example, in a non-formulaic way? So it's a very important thing. Ask the question in an indirect way, but at the same time, it's going to be a clear way for the patient, for the examiner, to understand what you're asking about. So ICE is a very important thing. Moving on, present a complaint, differential diagnosis, red flags, all of these are very important as the following bubbles in your consultation. After that, it comes a very important thing, which is home and work. Remember, when we were quite younger, we used to, get homework. So homework. What is the importance of home and work? Anybody knows what is the importance of asking home and work in the consultation, in the SCA, in the GP plan? Why? It is very important to ask this question. Anybody knows why? Dr. Dina or anyone?
Is the impact, to know the impact of the symptoms on.
All right. Okay. Okay. Anything else? Okay. Home and work, that is the main difference between you as a GP and between a hospital doctor. Hospital doctors do not really ask about home and work. They don't care. They don't care. And it's not that they don't care, no disrespect to anyone, but it's not their job to ask about home and work. They actually rely on us as GPs to ask about these things. Psychosocial impact, home and work. Never, ever end any consultation, actually never end any data gathering without asking about home and work. So very, very, very important to ask about. Then moving on to the another important thing, which is diet, exercise, smoking, alcohol, weight, drugs. So weight and drugs, all of these can actually be variable from a patient to another, but diet, exercise, smoking, alcohol can be also quite crucial in most of the cases. After that, family history, and last but not least is medication, right? Now, all of these are bubbles of consultation. And now what I have said so far actually belongs to data gathering. Anybody knows why I'm saying data gathering? Why this is important? Data gathering. Ask all of these information only in data gathering. Why this is important? Why it is important? What do I point at? What I do point at is that asking questions is only related to data gathering. But when it comes to management, here is your goal. You now start having a shared management plan. You don't have time to ask any questions. Actually, if you ask questions in management, you might actually sound unorganized. You might lose marks, which is the last thing that we want to happen anyways, isn't it? Now, moving to the structure of management, which is we always stress on. So your structure in management is start with recapping ICE if you can, then diagnosis, explain diagnosis in a very good way. By the way, anybody knows diagnosis, is it a part of data gathering or is it a part of management? Anybody knows?
Data gathering.
Data gathering. Okay. Why I'm saying that? Because if your data gathering lacking a very proper explanation of a diagnosis, it's very unlikely you're going to get a clear path in data gathering. So it's a very important thing to bear in your mind that a diagnosis is a part of your data gathering, not a part of your management. Then, to sound more shared, it's very important to say, oh, okay, there are a few things that we can do, including this, and that, and there are a few things that you yourself can do, including this, and that. Okay, so that's a very, very important thing. Shared management. It's not a one-way consultation; it's a mutual consultation. And ask the patient about their opinion. A very important secret I'm going to tell you guys all about. A very important question. Never ever end any management plan without asking a very important question. What is this question? Anybody knows?
Advising guys.
No. There is a very important question that is very crucial in the management. No one will ever tell you about it. A very important thing. Actually, this question